Let's begin with the next topic in head and neck now. Now we are going to learn about the pharynx. In pharynx, it's mainly about the wall of the pharynx, and wall of the pharynx will be actually having like 4 layers, and out of that, one of the layer will be your muscular layer. So our main focus will be on that muscular layer. So let us discuss about all the muscles of the pharynx. Then after that, we are going to learn about their nerve supply, and already we have learned about the nerve supply of these muscles in cranial nerves also. But we are just going to see like which muscle will be supplied by which nerve. And then later on, the most important thing for your exams is the structures which are going to pass between the constrictor muscles. So you'll be having constrictor muscles here, and what will be the structures, which arteries, which nerve will be passing between the constrictor. That is what is the main important thing to be learned here. Okay. So with that, let's get started first of all with the muscles of pharynx here, guys. So now to begin with, first of all, the muscles of pharynx, they are divided into 2 groups. All the muscles of pharynx are divided into 2 groups of muscles. The one on the inner side and then one on the outer side, sir. So you actually have like longitudinal muscles and circular muscles. An interesting thing here is the longitudinal muscles are present on the inner side, and the circular muscles are actually present on the outer side. The outer will be the circular, inner will be the longitudinal. Now, why I'm telling you this one is something interesting here. Why? Because after pharynx, in your entire gut, if you start from your esophagus and so on, so the stomach and all, always we have been learning inner circular, outer longitudinal. So I want you to be like very careful here. In pharynx, it is inner longitudinal, whereas outer circular. Okay. So therefore, we divide the muscles of pharynx into 2 categories. One will be the longitudinal muscles of the pharynx, and these longitudinal muscles of the pharynx will be on the inner side. There will be inner longitudinal muscles. And then we'll be having another group of muscles that will be circular muscles, and circular muscles will be on the outer sides, on the outer side. So there will be inner longitudinal muscles, and then there will be in outer circular muscles. And how many are there, sir? Like there are 3 longitudinal, there are 3 circular. So let us learn about them. What is the name? In the longitudinal category, number 1, you'll be having the stylopharyngeus muscle. There will be stylopharyngeus muscle. And the second one here will be the palatopharyngeus muscle. So stylopharyngeus and then the palatopharyngeus muscle. And the third one will be the salpingopharyngeus muscle. Salpingopharyngeus muscle. Now, the good thing here, my dear friends, the good thing here is that in the name itself, you have got the origin of all these muscles. For example, stylopharyngeus muscle begins from the styloid process. Palatopharyngeus muscle begins from your palate, originates from the palate. And then salpingopharyngeus muscle, it's going to begin from the tube, that is your auditory tube. So, stylopharyngeus, palatopharyngeus and salpingopharyngeus, from the name itself, you can learn the origin. So, step by step, you just keep on adding the points in your mind. Then on the other side, the circular muscles, and circular muscles names are very simple. They are all like constrictor muscles. So number 1, you will be having the superior constrictor muscle. There will be a superior constrictor muscle. And then you have got middle constrictor muscle. There will be middle constrictor muscle. And the number 3 will be the inferior constrictor muscle, guys. Inferior constrictor muscle. Perfect. So first you learn about the muscles of the pharynx, and all the muscles of the pharynx are divided into 2 categories, the longitudinal muscles and the circular muscles. So the longitudinal muscles will be stylopharyngeus and then palatopharyngeus and salpingopharyngeus, and circular muscles will be the superior constrictor and then the middle constrictor and inferior constrictor. And the arrangement of these circular muscles is like beautiful. If you just look at this picture here, you'll understand all those superior constrictor, middle constrictor, inferior constrictor, they are arranged like the reusable coffee cups, paper cups. So it's like one cup and then overlap with another one, then the overlap with another one. So you can appreciate here, there will be the superior constrictor and then the middle constrictor, and then here this will be the inferior constrictor. So all those constrictors are like one inside the another one. So superior constrictor overlapped by middle and the middle overlapped by the inferior constrictor. Perfectly done. Now, after learning these muscles here, I would like to add one more point here. The inferior constrictor. Inferior constrictor muscle in turn will have two parts in that. One will be the thyropharyngeus part. Don't worry about that. We are going to draw the diagram for that one. And then cricopharyngeus part. There will be thyropharyngeus and cricopharyngeus part. So, inferior constrictor is in turn having like two parts in that. One is thyropharyngeus part, another one will be the cricopharyngeus part. Now, once you are comfortable with all these names of all the muscles of the pharynx, the longitudinal muscles and the circular muscles, once you are comfortable with the names here, now let us learn about their nerve supply. And not even learning, we have to just recall. Why? Because already we have completed this in detail. The nerve supply of larynx, pharynx, all the muscles in head and neck we have completed in the cranial nerves category only. So try to recall. All the muscles of pharynx, will be supplied by vago-accessory complex, except two muscles. And which two muscles? Except which two muscles, guys? One is stylopharyngeus, another one is cricopharyngeus. Now, out of these two, cricopharyngeus is the one which will be supplied by recurrent laryngeal nerve. Cricopharyngeus is supplied by recurrent laryngeal nerve. Whereas stylopharyngeus, it will be supplied by ninth cranial nerve, that is your glossopharyngeal nerve. And even in the cranial nerves category, I told you how to remember that. Stylopharyngeus muscle, okay, wants to style, and for style you require gloss. So, stylopharyngeus muscle will be supplied by glossopharyngeal nerve. That's one exception. And cricopharyngeus muscle is supplied by recurrent laryngeal nerve. And if you remember these two, remaining all we don't even have to learn. All of them are supplied by vago-accessory complex. Vago-accessory complex. So, each and every remaining muscle will be supplied by vago-accessory complex here, guys. So, you just have to concentrate only on those two exceptions. So, by this very comfortably, we are actually done with the names of the muscles and we are even done with their nerve supply. Now, once you are done with the muscles and their nerve supply, and now I am very much curious to learn like how many layers will be there in the wall of the pharynx here and how many layers are there, and in those layers where do we have all these muscles? The muscular layer is exactly present where? Okay, so let's see the wall of pharynx. The wall of pharynx will be totally having like 4 layers. The wall of the pharynx will have 4 layers. And we are going to write down the names of all this from inside out. So, from innermost layer to the outermost layer. And of course, the innermost layer will be the mucous membrane. There will be the mucous membrane, the innermost layer. And around that mucous membrane, surrounding that mucous membrane, you will be having a fascia. And that fascia is known as pharyngobasilar fascia. Pharyngobasilar fascia. And from the name itself, you can understand that pharyngobasilar, that means it's actually from the pharynx and that will be attached to the base of the skull. That is the reason why the name is given as pharyngobasilar fascia. Pharyngobasilar, from the pharynx towards the base of the skull. And around that, the layer number 3, the layer number 3 will be actually the muscular layer. So, whatever muscles we have written just now, all those will be present in this muscular layer. And then again, outside these muscles, again there will be a fascia. It is covered by fascia on the outer side, and that will be the buccopharyngeal fascia. That is buccopharyngeal fascia. Perfect. So, again remember the arrangement, it is actually from inside out. So, innermost layer is mucous membrane, then surrounded by pharyngobasilar fascia, then surrounded by the muscular layer, and then you have got again one more fascia, that is nothing but the buccopharyngeal fascia. So, let's do one thing here. Let's actually try to draw one diagram here. The innermost layer will be the mucous membrane. Imagine this one here to be the mucous membrane. And this mucous membrane will be surrounded by a fascia, and that fascia will be the pharyngobasilar fascia. I will tell you there is some important thing regarding this one. Pharyngobasilar fascia. And then around that you will be actually having the muscular layer. There will be a muscular layer, layer number 3. And outside that muscular layer, again you'll be having one more fascia, and that fascia will be the buccopharyngeal fascia. So I'll just write down the numbers, whatever we have written there. So this is number 1, that is mucous membrane, that is your innermost layer. And this will be the number 2, that is pharyngobasilar fascia. And then the layer number 3 here, that's muscle layer. And finally the layer number 4, the outermost one will be the again fascia, that is buccopharyngeal fascia. Now in this all that wall of the pharynx, what I'm trying to teach you here, the important thing here is the layer number 2, pharyngobasilar fascia. In that pharyngobasilar fascia, dorsally there will be a thickening here, and that thickening here is referred to as pharyngeal raphe. This one is actually known as the pharyngeal raphe. And by the way, what is the importance of this pharyngeal raphe? The importance of this pharyngeal raphe is, it is the common insertion for all the constrictor muscles. Okay, let us even write down that one. What is the importance of this pharyngeal raphe, guys? It is the common insertion for superior constrictor, the middle constrictor, as well as inferior constrictor, for all constrictors. So what is the common insertion for all the constrictors? It is nothing but the pharyngeal raphe. And what is pharyngeal raphe? Where it is present exactly? It is in the layer number 2 from inside, and that layer is nothing but pharyngobasilar fascia. That's important. And not only this here, let me show you in the atlas image also, guys. Let's look at this image here. Now in this image, first look at this dorsal view. We are seeing from the back, dorsal view, back view, and you are able to appreciate a well differentiated, clear-cut pharyngeal raphe over here. And you can see all the superior constrictor, middle constrictor, inferior constrictor, all of them are inserting onto the pharyngeal raphe. Similarly, you can also see in the side view, there will be a pharyngeal raphe present here. And yes, the superior constrictor and the middle constrictor and inferior constrictor, all the 3 of them are getting inserted onto the pharyngeal raphe. Perfect. So superior constrictor, middle constrictor and inferior constrictor, all of them will be inserting onto the pharyngeal raphe. Common insertion point. Now in this, I want to tell you one important thing here. I want your concentration on inferior constrictor. And I have already said that inferior constrictor is the one which will be again having 2 parts. There will be thyropharyngeus part, and then there will be a cricopharyngeus part. Thyropharyngeus and cricopharyngeus. So why is the name given like that? Why? Because you can clearly see this is the thyroid cartilage here. And in the thyroid cartilage, there is one important landmark. This is the oblique line here. There will be an oblique line present there. From there, you are actually having a muscle, and this muscle definitely should be, what should be the name of this one? Thyropharyngeus, inserting on pharyngeal raphe. And below the thyroid cartilage, there will be cricoid, and from the cricoid cartilage, there will be cricopharyngeus. So now, let me take your concentration towards that inferior constrictor, 2 parts of that. I made you write down here, inferior constrictor, the 2 parts of that, thyropharyngeus and cricopharyngeus. Let me tell you the important concept related to that one. So muscles done, their nerve supply done, all the layers in the wall of the pharynx are done. And now let's learn one important concept here. Imagine this one here to be your thyroid cartilage. Okay. And just below the thyroid cartilage here, you'll be able to appreciate the cricoid cartilage. So this one here will be the cricoid cartilage. And just try to understand or imagine that this one here will be the pharyngeal raphe. We are trying to draw exactly the same diagram that I have just now shown you in a side view, from a side view. So imagine this one here to be the pharyngeal raphe. Now what about the constrictor? All the constrictors are going to insert onto the pharyngeal raphe. But we are not going to draw all the constrictors, not the superior, not the middle, only inferior. An inferior constrictor has got 2 parts. There is one important concept here. That is the reason why I'm making you draw this one. So one part is actually originating from that oblique line in the thyroid cartilage. And this muscle, which is going from the thyroid cartilage to the pharyngeal raphe. From the thyroid cartilage, it is inserting onto the pharyngeal raphe. This muscle is referred to as your thyropharyngeus muscle. This is the thyropharyngeus muscle. Hope it's perfect. Now, if this is the thyropharyngeus muscle, now what about the cricopharyngeus? It is actually from the cricoid cartilage. So, from the cricoid cartilage, from the cricoid cartilage to the pharyngeal raphe here, this one, you just imagine this one here to be the cricopharyngeus muscle. Perfect. So let me just write down the name here, guys. This muscle here will be thyropharyngeus muscle. And this one here will be the cricopharyngeus muscle. Cricopharyngeus muscle, guys. Thyropharyngeus and cricopharyngeus. And both of them are a part of your inferior constrictor. Don't forget that one. Both of them are an inferior constrictor. Now, the problem here is that between these two muscles, there is actually a triangular area of weakness. It's actually a very weak area. So basically, I'm referring to this area between these two muscles. Just for the sake of diagram, I'm drawing it like this, guys. But in the diagram, you will not be able to appreciate that very clearly over there. But try to understand. For the sake of understanding, I'm drawing the diagram like this, more far away. So there will be an area of weakness between these two muscles, and this area of weakness is referred to as Killian's dehiscence. Killian's dehiscence. That's the reason why I'm actually teaching you this one here. So between thyropharyngeus and the cricopharyngeus, between these two, there will be area of weakness known as Killian's dehiscence. Now the problem is, try to recall the nerve supply. Is the nerve supply same for these two muscles? Absolutely no. Cricopharyngeus, it is supplied by recurrent laryngeal nerve, whereas thyropharyngeus is supplied by vagoaccessory complex. Recurrent laryngeal nerve that is supplied by vagoaccessory complex. Now, the nerve supply to these two muscles is different and a slight bit of incoordination. Okay, then what is going to happen from that area of weakness? What is going to happen, sir? There will be a diverticulum, and that diverticulum is very famously referred to as Zenker's diverticulum. So from this Killian's dehiscence, you will be able to see the Zenker's diverticulum. Zenker's diverticulum, guys. That's the important concept here. So in the inferior constrictor muscle, you have got like two parts. Very easy to remember from this diagram here. Thyropharyngeus muscle and then cricopharyngeus muscle. Between these two, the area of weakness, Killian's dehiscence, it will lead to a diverticulum. That diverticulum is nothing but Zenker's diverticulum. Now we got to even learn the positioning of the diverticulum. Is it like anterior, posterior, lateral, superior, inferior? What is the position of that one? See, one thing, Zenker's diverticulum cannot be completely towards the lateral wall. Why? Because we are learning about which muscles here? Constrictor. And constrictors are not going straight like this. They're in the pharyngeal wall. They are taking a turn. They're going around like a circular muscle. So it is completely not at all on the lateral wall of the pharynx. And not only it is completely on the posterior wall of the pharynx. So it is like posterior-lateral because it is taking a turn, right? So therefore, that Zenker's diverticulum will be present on the posterior-lateral wall of the pharynx. So it is on posterior-lateral wall of pharynx. So Zenker's diverticulum will be present on the posterior-lateral wall of the pharynx. That's one important thing. Already tested in your exam, and I hope you understood where exactly will be the Zenker's diverticulum between the thyropharyngeus and the cricopharyngeus. There is an area of weakness, and that is the area where you have a diverticulum forming there. Done. And all the constrictor muscles, the common insertion will be on the pharyngeal raphe. Now moving ahead, after this longitudinal, inner longitudinal and the outer circular muscle, now the most important thing, what are the structures between the constrictors? Let me first of all show you the atlas image over here. Now in this atlas image, I hope you are able to appreciate there are three constrictor muscle here: superior constrictor, middle constrictor and inferior constrictor. And in this diagram itself, you are able to appreciate here. In this diagram itself, you are able to appreciate like many structures passing between the constrictor. So let me do one thing here, guys. First, let me show you in this diagram. Then later on, we'll draw like our diagram here. First of all, if this one here will be the superior constrictor, this is superior constrictor here. Like what do you have above the superior constrictor? Yes, sir, we are able to appreciate one fascia over here. Fine. What is that fascia? Now try to recall, that's the reason why I taught you about the wall of the pharynx. Outside the wall of the pharynx, you'll be having buccopharyngeal fascia. We have removed that buccopharyngeal fascia. Then you're able to see the muscular layer. Okay. Inside the muscular layer, one more fascia, that is pharyngobasilar fascia. And I told you very clearly, it's from the pharynx attached to the base of the skull. Everything perfectly true here. So what is the fascia inside the muscle layer? Inside the muscle layer, the fascia will be pharyngobasilar. Yes, that fascia is pharyngobasilar. And there, that space there is nothing but sinus of Morgagni. So above the superior constrictor, we have to learn about what are the structures passing in sinus of Morgagni. Number one. Number two, between the superior constrictor and the middle constrictor. I'm just trying to give you an idea here. Then later on, we are going to even draw the diagram here, guys, complete diagram. So this one is your middle constrictor here. Perfect. Now, what is the structure passing in between the middle constrictor? Appreciate there, you are able to see a muscle from the styloid process. And you can see there, that muscle is actually going inside. I told you already, longitudinal muscles are going from inside, inner longitudinal. That is stylopharyngeus. From the styloid process into the pharynx, stylopharyngeus. Now try to recall in your mind, stylopharyngeus muscle will be supplied by which nerve? Stylopharyngeus muscle is supplied by which nerve? It is supplied by ninth nerve, glossopharyngeal. Even ninth nerve will also go along with that one. That's a hint there. So between the superior constrictor and the middle constrictor, you have got stylopharyngeus muscle. Along with the stylopharyngeus muscle, the nerve supplying to that one, glossopharyngeal nerve. And now, if this is your inferior constrictor muscle over here, observe there, this is your hyoid bone, and below here, this is the thyroid cartilage, and between them, there is a membrane, thyrohyoid membrane. And already in the vagus nerve topic, we have discussed that thyrohyoid membrane will be pierced by internal laryngeal nerve, the nerve which is going inside. So, internal laryngeal nerve is actually going inside. Okay. And then what about the recurrent laryngeal nerve? It's like very, very famous, guys. Trachea here, and then you have got the esophagus here, and in the tracheoesophageal groove, you'll be having the recurrent laryngeal nerve here. So above here, there'll be internal laryngeal nerve, and below there will be a recurrent laryngeal nerve. And blood vessels are very much easier, superior and inferior laryngeal blood vessels along with that one. So keeping this entire idea in the mind, let's get started with all the structures which are going to pass between the constrictors. All the structures going to pass between constrictors. So, structures passing between constrictors. Very important concept here. Many questions are being asked from this concept here, guys. First of all, imagine this one to be the base of the skull. This is the base of skull. So we are going to draw the same diagram as if though we are actually seeing from behind. There is the dorsal aspect, dorsal view. So if you see from the dorsal aspect, if you see from behind, from the base of the skull, you will be able to appreciate the pharyngeal raphe in the middle. That's your pharyngeal raphe. And all the constrictor muscles are coming and getting inserted onto the pharyngeal raphe. Superior constrictor, then middle, and then inferior. So just for the sake of, schematic diagram here, a simple diagram here, you imagine this one here to be the superior constrictor muscle. And then you imagine this one here to be the middle constrictor muscle. And then you have got the inferior constrictor muscle. So I'm just writing here as superior constrictor, the middle constrictor, and the inferior constrictor. Perfect. And just now we have seen that there will be a fascia which is present inside the muscular layer. What is the name of the fascia present inside the muscular layer? That is pharyngobasilar fascia. It is attached to the base of the skull. So what is the name of this fascia here, guys? This one is nothing but the pharyngobasilar fascia. Let me just write down here. Pharyngobasilar fascia. So that you don't forget this one while revising. That is the fascia that you are able to appreciate inside the muscle, And what is the space here? This is nothing but the sinus, and it is sinus of Morgagni. Be very careful. We get this word a lot of times at other places also, but this one is sinus. Okay, this is the sinus of Morgagni. Now, what is going to pass from here? The sinus of Morgagni. Come on, let's get started. And please keep that entire overview, entire planning that I told you just few minutes back. If you remember that in your mind, that entire picture, then easy to write down here, guys. We just have to write down here. Now, first of all, through the sinus of Morgagni here, this part, first of all, there will be a tube passing here, and that will be your eustachian tube or artery tube. So imagine this one here to be your auditory tube here. And attached to auditory tube, you'll be actually having a muscle, and that muscle is also passing here. And this muscle is the one which is attached to the auditory tube will be the levator veli palatini. I'll just write down here itself, guys, LVP. Now, don't think that if it is auditory tube there, it is the salpingopharyngeus muscle attached there. Be very careful. Many students will be doing a mistake there. Auditory tube, salpingopharyngeus. No, it is not the salpingopharyngeus. It is levator veli palatini muscle. Levator veli palatini muscle. Apart from that, you also have got like two arteries passing from here. And I want you to be like more careful here while learning their name. The name of these two arteries which are passing from here. Number one, you actually have ascending palatine artery. There will be ascending palatine artery. Ascending palatine artery, okay. And this ascending palatine artery we are going to learn in the branches given by the facial artery. After that, we also have got like one more branch here, palatine branch of ascending pharyngeal artery. Ascending pharyngeal artery. Now, where do we get this branch, sir? Ascending pharyngeal artery? That is actually a branch of your external carotid artery, okay. So, palatine branch of ascending pharyngeal artery, another one is the ascending palatine artery. So, these two arteries are going to pass through the sinus of Morgagni along with auditory tube and then levator veli palatini muscle. Perfectly done. Then in the diagram I have shown you between the superior constrictor and the middle constrictor. Let me just go back to the same diagram again. Yes. Between the superior constrictor and the middle constrictor, we have seen the muscle coming from the styloid process, and that is stylopharyngeus muscle. So it's like easy to remember now. In between superior constrictor and middle constrictor, there will be a muscle coming from the styloid process. Therefore, the name of this muscle here will be the stylopharyngeus muscle. Stylopharyngeus muscle, and it is going from inside. Why? Because longitudinal muscles are present on the inner side in the pharynx. And along with the stylopharyngeus, definitely without any doubt, which nerve is going to go along with that one? The nerve going along with that one is definitely the ninth cranial nerve. Ninth nerve. Stylopharyngeus will be supplied by glossopharyngeal nerve that is passing from there. Then what is going to pass between the middle constrictor and the inferior constrictor? Middle and inferior constrictor, I told you there, you have to remember the hint. The hint there is that there is a membrane. Which membrane? Thyrohyoid membrane. Thyrohyoid membrane. And what is the nerve which is going to pierce through the thyroid membrane and go inside the larynx? If it is going inside the larynx, definitely the name of the nerve will be internal laryngeal nerve. Internal laryngeal nerve, which is actually in turn a branch of your superior laryngeal nerve. Superior laryngeal nerve. Then what do you have below this inferior constrictor? And I told you how to remember that. Below that you'll be actually having the trachea and the esophagus, and in the tracheoesophageal groove, the nerve which is going down and then again taking a turn, coming back again. So any nerve which is going actually forward and again taking a turn back and coming back are recurrent. And what is the name of this one here? This is a recurrent laryngeal nerve. A recurrent laryngeal nerve. So you just try to remember the hint here. So where is that recurrent laryngeal nerve passing? It is between the tracheoesophageal groove. Better you write down the hint there, how to remember. Recurrent laryngeal nerve will be present in the tracheoesophageal groove. Tracheoesophageal groove. Okay. And even for the internal laryngeal nerve, if you just want to remember the hint, why? Because in long term, you have to remember like many subjects. Better try to make some concept and remember. Internal laryngeal nerve, how to remember that? It is the one which is piercing. It pierces thyrohyoid membrane. Internal laryngeal nerve is going to pierce through the thyrohyoid membrane, whereas a recurrent laryngeal nerve is passing through the tracheoesophageal groove. Perfect. And along with that, the easiest part here is that you are able to see even the artery going along with that one. And there is one more artery going along with this one. And this is very easy. Why? Because those arteries are actually above the larynx and below the larynx, superior laryngeal vessel and inferior laryngeal vessels, guys. So you don't have any issue with the artery here. So this one here will be the superior laryngeal vessels, and then here you'll be actually having the inferior laryngeal vessels. So that is one easy thing, guys. And these two structures are going to pass from where? The inferior laryngeal vessels along with the recurrent laryngeal nerve. These two are going to pass below inferior constrictor. Between middle and inferior constrictor, you'll be able to find the internal laryngeal nerve along with the superior laryngeal vessels. And then between the superior constrictor and the middle constrictor, you are able to see stylopharyngeus muscle along with the nerve supplying to stylopharyngeus, that is glossopharyngeal nerve, ninth nerve. And we have already seen the structures passing through the sinus of Morgagni. And this is extremely important in the pharynx topic. Okay. So therefore, we are done with the wall of the pharynx, all the 4 layers. And then in detail, we have discussed about the muscle layer, inner longitudinal, outer circular. And in that muscle layer, one important topic that has to be discussed, that is about the Zenker's diverticulum. And then what is the nerve supplying to all the muscles of pharynx? And finally, the most important thing, what are the structures passing between the constrictor? And that too we have done in a very conceptual manner, and how to remember that for a longer duration. Is it okay? So that's all about the pharynx topic. Hope you have enjoyed that. Thank you.